today we discuss about next chapter, sympatholytic drug. Sympatholytic drug is also called as anti-adrenergic drug. First, what do you mean by the sympatholytic drug or adrenergic drug? Anti-adrenergic drug. Anti against the adrenergic. The drug against the drug against the adrenergic drug. You know the against. Now see the definition. The agent which antagonize the agent or drug which antagonize the action of sympathomimetic or adrenergic drug are called sympatholytic anti-adrenergic or adrenergic antagonist. Now see the definition. The agent which antagonize the action of sympathomimetic drug means or adrenergic drugs means those drugs antagonize means they are block the action of gonist. Now here is the antagonize, this block the action of adrenergic drug is called as the sympatholytic drug, anti-adrenergic drug or adrenergic antagonist. Antagonist, that is called the blocker. Okay, now these the definitions. Now the classification based on the mechanism of action. Now the next point, classification based on mechanism of action. It can be divided, classify into three groups. देखा है, drug can be classified into three groups. Now first, adrenergic receptor blocking agent. They are alpha and the beta receptor blocking agent. They are further can further classify alpha and beta receptor blocker, alpha and beta receptor blocker and alpha plus beta receptor blocker. Second, adrenergic neuron blockers. Now the example of that, common example Lesapine. Example, lesapine, gunithiadine, this. And the third class, next, the agent inhibiting the synthesis of catecholamine. Example, methyl dopa. These are the classifications. So you can see the next. First, alpha adrenergic blocker receptors. The next topic is alpha adrenergic receptor blocking agent. These classifications. Now alpha adrenergic receptor, they are this drug inhibit the adrenergic response mediated through alpha receptor. Alpha means alpha adrenergic receptors. They are classified as now the first class, non-selective. The non-selective alpha, that means alpha 1, alpha 2 adrenergic receptor. Again they further classify beta alkyl amines. Example, phenoxybenzamine is a common example. Phenoxybenzamine. Second class, imidazolines. Example, pentolamine. Zoline. See, natural and heterogenated ergot alkaloids. Example, ergotamine, ergotoxin, dihydroxy, ergotamine. DHE can use in the del vasomotor reversals. They are blocking by the alpha receptors. Now second class, alpha 1 adrenergic blocker. This agent or this drug is block only the alpha 1. Previously even alpha and beta both they can the block. Now alpha 1 adrenergic specific blockers, parazosin, example pramazosin, terazosin, now last alpha 2 adrenergic blocker. Now this agent blocked by only alpha 2 receptor action mediated through yahimbin, idazocan. Now these are the classification of alpha. Now see the example of that. Phenoxybenzamine, that is non-selective blocker. It is a non-selective alpha blocker, that means alpha 1 and alpha 2 blockers. It is having the class beta hydroxy alkyl amine, phenoxybenzamine. Okay. Now their action on CVS. Phenoxybenzamine is an alpha adrenergic, you can write down full form, don't write short form, blockers, and the effect are irreversible. That is most important thing there. They produce the effect is irreversible. The effect is produced by irreversibles. It is effectively inhibited by alpha adrenergic agonist. The onset of action is gradual. Is gradual. Blocking the blockage of alpha receptor causes hypotension. The blocking of alpha receptor, the hydroxymeroxine caused by the hypotensions. The other action is it does not have metabolic effect. It does not have metabolic effect. It entered the brain and stimulation of CNS. It entered the brain and stimulate the CNS, causing nausea, vomiting. It's causing nausea and vomiting. The side effects: is cause hypotension, that is postural hypotension, miosis, contraction of the pupils, nasal stiffness, and tachycardia. Bradycardia and the tachycardia, that is upper part of blood pressure should be the rise. The next, another drug. Next drug is ergot alkaloids. The ergot alkaloids contain the number of alkaloids. It contains the number of alkaloids. The alkaloids have the partial agonist and weak antagonist action of alpha adrenergic receptor. Its main action. Its main actions are stimulation of uterine smooth muscle, that is called oxytocic activity. Second, alpha receptor blocking activity. The block by alpha receptor blocking activity. This activity produces both. This activity produce both by natural and dihydrogenated alkaloids. The effect is competitive. They act as competitive actions, and duration of action is short action. Duration of action is short. It is also entered the brain. And causing nausea and vomiting, and have stimulant effect, ergot ergot is a potent vasoconstrictor. And it is used in treatment of migraine. Continuous headache. Continuous headache and continuous in the sense of headache is start from whole day. It can't stop within 1 hour and 2 hours. There is no use of analgesic drug effect. Only use the ergot alkaloids. They are best treatment in the migraine. The pain should be the unbearable headache. Therapeutic use. Therapeutic use of alpha adrenergic blockers. It is commonly used for oxytocin. They stimulate the uterine smooth muscles. Second, it is used treatment of migraine. Just see the migraine is a continuous headache. And third, bromocriptine. Bromocriptine is used in treatment of Parkinson's disease. Ergot alkaloids and the bromocriptine used in treatment of Parkinson's disease. Now these are the alpha receptors. Alpha adrenergic receptor blocking by alpha and beta 1. Now the next topic, continue for the chapter. Beta adrenergic receptor blocking agent. The agent blocked by beta 1 and the beta 2 receptor, that is called as the non-selective blocking agent, means they blocked by beta 1 and beta 2. Previously you can see adrenergic non-selective, they blocked by alpha 1 and the alpha 2. Their classification and example are ergotamines, phenoxybenzamines. Now here is a beta, they blocked by beta 1 and beta 2. Now see the classification. Classification is should based on the beta receptor blocking. Now the first one. Now selective means they block by the both beta 1 and beta 2 receptor, that is called the beta blocker. Okay, then again further classify having a local anesthetic and sympathomimetic activity. Example, DCI promethyl. B, having local anesthetic but no sympatholytic activity. Example, propranolol. Common example, sotalol, nadolol. Third, no local anesthetic but with sympathomimetic activity. Example, indolol, oxyprenol. And D, alpha and beta blocker, labetalol. Second class, beta, that is now beta 1 blockers, cardioselective blocker. Example, metoprolol, atenolol, tamalolol, isamololol. Now the beta 2 selective blocker, they block only beta 2. Example, betoxamine. Now see the pharmacology of propranolol. Propranolol is having the local anesthetic but no sympathetic activity. Now is act on the CVS. Now the propranolol is a blocker of the agonist of sympathetic drug. That the sympathetic drug is adrenergic drug. Sympathetic drug, that is adrenergic drug. Example, adrenaline. Adrenaline is having the stimulatory effect. Propranolol is having the blocker of the adrenaline blockers. They block the adrenaline all actions. Now here action. The adrenaline is produced cardiac stimulatory action. Now what happened? Now the propranolol, why they produce acted? Because of beta 1 receptor, they are stimulated. This receptor. Now this propranolol blocked by the beta 1 receptors. This blocked by the beta 1 receptor. What happened now? They decrease the heart rate. They decrease the force of contraction, and they decrease the cardiac output and falls in the blood pressures. Okay. The propanol, it reduces the cardiac work and oxygen consumption of the heart and blocked by stimulation by the it reduces the cardiac work, propanol, and oxygen consumption of the heart, oxygen consumption of heart, and blocked by stimulatory effect and the adrenergic drugs. Okay. Second, now the first serious, second smooth muscle action on smooth muscle. Now adrenergic, now in the C, the adrenergic is stimulate the now here adrenergic drug, adrenaline is stimulate the beta 2 receptors, and they can use in treatment of asthma. All the smooth muscle can be dilated. Now here propanol blocked by the all the beta 2 receptor, the blocking action of beta 2 receptor, the beta 2 receptor blocking action in smooth muscles. Bronchial smooth muscle, they can block the action all the smooth muscles and relax the uterus. Okay. Now next action, CNS action and CNS, they entered in the brain and they caused by forgetfulness, you can't remember, you can forget about every time, and they also increase, they caused by another things, that is first forgot, second dreaming, okay. Next action on local anesthetic, local anesthetic, local anesthetic effect. The propanol has potent local anesthetic effect. Anesthetic effect. But propanol show the potent local anesthetic effect, but it is not used for this purpose because other important action. Like that, blocking by the smooth muscle, blocking by the alpha 1 receptors, that's why they never use. Next, other actions, other action of the propanol, they block by the beta blockers. Beta blocker reduce the intraocular intraocular tension and reduce the metabolic effect. Now the side effects. Propanol cause bradycardia, fall down in the blood pressure. That is major adverse effect. First, it can also cause by the precipitate CHF, congestive heart failure, peripheral vasoconstriction, peripheral vasoconstriction, and sodium and water retention. It can cause, another side effect is bronchoplasms, because they blocked by the beta 2 receptor and they are constrict the smooth muscle, they call the plasm. Another most important thing, it is contraindicated. Contraindicated means this drug should not use for such a disease, for given maybe increase patient having the more troubles. It is contraindicated. The propanol knows use in the asthmatic patient. It is contraindicated. It is not used in the asthma, because they use in asthma that bronchoplasms, and difficulty in the breathing is occur. Okay, there is a contraindicated in the asthma. Now therapeutic uses of beta blockers. These drugs are used mild antihypertensive. These drugs are used for essential hypertension. These drugs are for essential hypertension. They use for the mild antihypertensive, agents. It is used for angina pectoris. Beta blocker, commonly used in treatment of angina pectoris because they block by the beta receptors. Third, it is used in cardiac arrhythmia. It is used in treatment of cardiac arrhythmia. Common example, propranolol, most common. It is used in treatment of myocardial infarction. It is used in treatment of migraine. And last, it is used in treatment of glaucoma. Commonly example, it is used glaucoma. Timolol is used. They reduce the intraocular. Is reduce the intraocular potential. Okay, now this chapter is finished. Thank you.